Good afternoon, everyone. Welcome back to, I'm Steve,
And I'm Scott.
and together we're Backyard Musing broadcast in Apple Valley, California, Southern California, sunny, really nice
Yes.
California.
Beautiful February.
And we are the Science and Technology channel, bringing you all things science and technology. Great segment today. Scientists have developed new light-sensitive chemicals that could significantly enhance the treatment of aggressive cancers while minimizing side effects. In laboratory tests on mice, yay mice, right?
Yeah.
The therapy completely eliminated metastatic breast cancer tumors. These newly developed compounds, known as cyanide-carborane salts, are detailed in a recent study published in Angewandte Chemie, a journal of the German Chemical Society. Would you like to know more?
The treatment builds on photodynamic therapy, PDT, a method that has been used for decades to treat skin and bladder cancers. PDT involves introducing light-sensitive chemicals into the body where they accumulate in cancer cells. When exposed to light, these compounds activate and destroy the diseased cells. The light causes the chemicals to generate highly reactive oxygen molecules like tiny biochemical firecrackers that break down cancer cells from the inside while leaving healthy cells unharmed.
Now, I was exaggerating with that pop. I don't think that's what.
I don't know. Maybe so. I mean, how long does it take? Very long for these things to get destroyed? I don't know.
Hopefully, it's not a pop when you feel it.
Yeah.
It is a useful therapy with several drawbacks that limit its effectiveness. So it's got some risks to consider, including prolonged light sensitivity, poor tissue penetration, and off-target toxicity. These drawbacks can prevent complete tumor eradication and may lead to a recurrence of the cancer. The multidisciplinary research team is composed of scientists from University of California, Riverside, UC Riverside, right down the hill,
Yeah, very close,
and Michigan State University, the Trojans, MSU, Trojans.
Okay. Cyanine-carborane salts minimize these challenges, offering a safer, more precise way to destroy tumors completely while sparing healthy tissues. That's according to Professor Sophia Lunt, MSU cancer researcher and co-principal investigator of the project. The researchers said current FDA-approved PDT chemicals remain in the body for extended periods at a time. After treatment, patients have to stay in the dark for 2 to 3 months because even low levels of light will cause them to become blistered and burned.
Dang,
Wow.
They should send them up to Alaska.
Yeah.
Like in December.
That would be tough, right? That would be tough to be inside.
That would be really tough. I mean, that's a big drawback.
Yeah. In contrast, the researchers found that cyanine-carborane salts flush out of the body more quickly, remaining only in the cancer cells requiring treatment. So, that's a downside. But I mean, if you've got like a high stage breast cancer, would you be willing to do that? I think so.
I think
right?
I would, yeah. I think I would if it didn't catch it in time and it's at a high stage.
Yeah.
Vincent Lavallo, UCR, University of California, Riverside, chemistry professor and co-principal investigator, is an expert on the synthesis of carboranes. Quote, "The most interesting thing is the targeting ability of this substance we made to go right where it's needed and stay there while the rest passes through. That way, you'll only kill the cells right where the cancer is, but not harm the patient," Lavallo said. Lavallo worked together with Richard Lunt, MSU endowed professor of, I wonder if he's married to Sophia Lunt, that MSU professor, chemical engineering, to develop the cyanine-carborane salts.
Unlike conventional PDT agents, the salts exploit a natural vulnerability in cancer cells. They're taken up by proteins called OATPs that are overexpressed in tumors. This allows for precise targeting without the need for costly additional chemicals currently used with PDT to help target the cancer cells. Traditional PDT is also limited in its ability to treat deep-seated tumors because it works with wavelengths of light that only penetrate a few millimeters into the body.
So the light penetrates in the body to do this.
Yeah. I wonder. Wow. Hopefully it doesn't affect like your like skin for skin cancer and stuff. Once inside cancer cells, cyanine-carborane salts can be activated by near infrared light that is able to move deeper into tissues. That's fascinating.
Yeah.
This could expand the range of cancers that could be treated. So that's
cool. Given their success, researchers are encouraged to continue the research and try to expand the types of cancer therapies the salts can be used with. It may be possible to alter the salts so that they can be used with energy sources other than light that penetrate even more deeply into the body, like sonogram type stuff,
This is a quote. Our work offers a targeted, safe, and cost-effective treatment for aggressive breast cancers with limited treatment options, says Amir Roshanzadeh, paper first author and MSU Cell and Molecular Biology graduate student. Again, on with a quote. It also opens the door to breakthroughs in other approaches for cancer therapy and targeted drug delivery. So
this sounds very promising. Pretty awesome. Yeah.
No,
gives hope for those people out there that are listening.
It does. Yeah. This is the kind of stuff you want. I mean, they've been working on stuff for decades, right? For cancer treatment.
Yeah.
And this is this stuff.
And it's not just medicine now, it's like procedures. It's really cool.
Right. That's good.
All right, folks. Thanks for joining us, and we'll see you in the morning.
Yep. Take care, everyone.